Thanks for joining us. Thousands of Allina nurses from 5 Twin Cities hospitals, including Mercy and Unity, walked off the job on Labor Day.
That came just days after a marathon 22-hour bargaining session that ended without a new contract agreement. Allina has brought in 1,500 replacement nurses on temporary contracts to staff the hospitals during the second strike, with no end date in sight. CTN's Jordan Rylands has more on how the strike is impacting Mercy Hospital here in COON Rapids.
Allina nurses are on strike for a second time in 4 months. Allina officials and nurses failed to come to contract agreements on healthcare coverage, nurse safety, and staffing last week, prompting an open-ended strike.
We're disappointed that the union has decided to strike. We don't believe that was necessary to get this done.
While Allina officials continue to focus their efforts on a new healthcare coverage plan, nurses say there is a disconnect between what they want and what is being offered.
The nurses are becoming assaulted at a higher rate than they ever have in history. So it's important to us to get some safety protection for our nurses too as they're giving care to our patients.
Mercy Hospital has 1,000 full and part-time nurses on staff. Officials have brought in just 250 replacement nurses to fill those positions, and that's a number that's concerning to these Mercy nurses.
There is no way that you can care for a patient properly with only 1/4 of the nurses that are employed at this hospital, so that does raise questions.
But Criger says patient care has not and will not be affected during the strike, despite the nurse deficit.
Many of the permanent nurses don't work full-time. The replacement nurses, this is kind of what they do as a profession, so they work 12-hour shifts versus our nurses who work 8-hour shifts and maybe not even 5 8-hour shifts a week. So there's fewer people that are needed to fill the spots.
Right now, there is no talk of another meeting at the bargaining table, but these Allina nurses hope an agreement can be reached soon so they can get back to their patients' bedsides.
It's devastating for us. You become a nurse because it's usually a calling. We don't want to be away from the patients.
In COON Rapids, Jordan Rylands, CTN News.
Mercy officials say about 14% of their nursing staff have stayed on the job, a number higher than the last strike in June, which lasted just 7 days.